Hi, welcome to today's segment on what in the world does a speech language pathologist do? My name is Michelle Richardson. I'm an SLP and owner of Richardson Speech and Voice in Virginia. And I can't tell you how many times I used to walk into a patient's room. I'd tell them who I was and what I do, and they would say, "Well, I don't need speech therapy. I'm talking just fine." And it is true, speech language pathologists do work on speech and language, talking, but our scope of practice encompasses so much more than that. And so I thought today would be a great day to explain everything that speech therapy can help with and see if it might be something you would benefit from. So SLPs can work with anyone from birth to end of life. In pediatrics, we work with newborns and infants who have difficulty latching or feeding or swallowing. In toddlers and preschoolers, we work on those pre-language skills to get them ready for communication. Things such as play skills and attention, eye contact, turn taking, following directions, cause and effect, all of those precursors to communication to help prevent later delays. We also work on expressive language and vocabulary, as well as articulation or speech disorders, speech errors, in all pediatric ages. A lot of kiddos have difficulty reading, and even though we are not reading specialists, typically if there's a reading difficulty, there's also a phonological component or a working memory component that's causing the difficulty or contributing to the difficulty reading. And so we love to work on those things that often help with reading fluency and reading comprehension. One of my favorite areas to work on are with kiddos who are nonverbal and they rely on other communication methods such as sign language or picture systems or what you might have heard of as an AAC device, augmentative alternative communication devices. We can work on pragmatic and social language skills with any age. Many of my favorite sessions have been with teenagers and adults in their early 20s learning appropriate social skills for their home, work, or school environments. Those are really, really fun. We love working alongside occupational therapists, also known as OTs, to help with varying degrees of behaviors and sensory needs that often go hand in hand with language needs. Moving on up in the age populations, SLPs can also work with adults who've experienced neurological and voice changes, such as traumatic brain injury, stroke, head and neck cancer, neurodegenerative diseases such as Parkinson's disease. These populations often experience swallowing difficulties, voice changes, slurred speech, difficulty getting their words out or finding the word they want to say, or varying cognitive changes. And so we can help with all those things. I often joke with my patients that I can help them with anything from the throat upward. So if you have any questions about if speech could help you or your loved one, don't hesitate to reach out. Many SLPs, including myself, offer free screenings to determine if speech could be a benefit for you. So feel free to reach out. On this page, you'll see my website and phone number and email address. Don't hesitate to reach out if you need anything at all.